All right, let's go ahead and get started. Well, I appreciate everybody joining us today. Welcome. This is our webinar series called Sight and Sound Bites. It's brought to you by the Eye and Ear Foundation. My name is Craig Smith. I'm Director of Development and Community Initiatives here with the Foundation. This biweekly webinar series highlights research in the two world-renowned departments of ophthalmology and otolaryngology at the University of Pittsburgh School of Medicine. The research that you're going to see talked about today, it's only possible thanks to generous philanthropic support. So we want to thank everybody who has supported us in the past. I want to go over a few housekeeping items for today. For these webinars, we do disable the chat function, so you won't be able to chat. However, you can submit questions for our presenters at any time using the Q&A feature. And then after the presentation, we'll have an open Q&A session where they'll answer the questions from the audience. We do ask that you refrain from asking any very personal medical questions that might not be relevant to the broader audience. However, we will try to answer those questions for you offline, so you can feel free to send those questions to me. My email is craig@eyeandear.org, and if you send those questions over to me, we'd be happy to send them to our presenters and try to get an answer for you. We've also enabled captioning for this program, so please feel free to use subtitles as you follow along, and we'll be recording this webinar and adding it to our website and our YouTube channel as always. So if you're not able to view the whole thing, or if you'd like to share it with anybody, please feel free to do so afterwards, and it'll be added sometime next week. And additionally, all of you who are attending today will be added to our mailing list so you can receive periodic updates on all the various research taking place within the two departments through blogs, newsletters, annual reports, future webinars, etc. So today's presentation is going to be a great one. It's titled Personalized Refractive Surgery, LASIK and ICL. I'm joined by two of our esteemed faculty members, Dr. Deepinder Dhaliwal and Dr. Sabrina Mukhtar. Dr. Dhaliwal is a professor of ophthalmology at the University of Pittsburgh School of Medicine and serves as vice chair for communication and wellness and chief of refractive surgery in the Department of Ophthalmology. Dr. Dhaliwal is also the director of the UPMC Laser Vision Center, the associate medical director of the Campbell Ophthalmic Laboratory, and clinical co-director of the Corneal Stem Cell Task Force at the University of Pittsburgh. She earned her medical degree from Northwestern University and completed her residency at the University of Pittsburgh. She then completed a prestigious fellowship in cornea and refractive surgery at the University of Utah. She became a licensed acupuncturist in 2006 and founded the Center for Integrative Ophthalmology here at the University of Pittsburgh to systemically research holistic treatments for eye disease. Her other research interests include corneal regeneration, dry eye disease, ocular microbiology, and pediatric refractive surgery. Dr. Sabrina Mukhtar is an assistant professor of ophthalmology here at the University of Pittsburgh with a specific interest in refractive surgery, cornea, and ocular surface disease. She obtained her medical degree from Virginia Commonwealth University and completed her residency here at the University of Pittsburgh Medical Center, where she served as chief resident during her time. She stayed at UPMC to complete her cornea and refractive surgery fellowship. Apart from scholarly and clinical focus on dry eye, she routinely performs cataract, corneal, and refractive surgery. She currently is the director of the Dry Eye Center of Excellence here at the University of Pittsburgh Medical Center. And at this time, I'd like to turn it over to our presenters.
Thank you so much, Craig.
Thank you, Craig. We're so happy to be here, and thank you all for tuning in.
Yes, we are absolutely thrilled to be spending this hour with you all. Again, we want to keep this really interactive. We're going to start with a brief presentation, and then we want to open it up to you all so you can ask us any questions that you have about refractive surgery. So let's get started with kind of our personalized approach to refractive surgery. So we opened the center, our refractive surgery center, in 1995. So that was 30 years ago. So we are the longest running laser center in the entire Western Pennsylvania area. So we've been doing this for a long time, and we're really passionate about it because we really feel that it can change your life if you're a good candidate. So Dr. Mukhtar, talk to us about the burden of refractive error.
So refractive error actually does have a significant burden. It is actually one of the leading causes of blindness if uncorrected, actually globally. To give you some perspective, in the United States, about 40 million people 17% of our population are dependent on contact lens wear. And of course, as expected, a higher percentage, close to 64% of people in the United States wear prescription glasses. This can be very significant for the patients, being able to do the activities that they need to do, impacting their quality of life. And it can, over time, become a financial burden for our patients as well. As you can imagine, or at least I know, that glasses and contact lenses can be quite expensive over time. And then with contact lenses as well, we're really passionate about contact lens safety. And so all of our team here at UPMC Vision Institute and Eye Center really educate all of our patients about contact lens safety. But for us, as cornea specialists, we do see some issues with infections from that as well. So our patients are readily excited to come to see us for refractive surgery evaluations.
Yeah, absolutely. So the thing is, refractive error is basically the fact that you can't see unless you have glasses or contact lenses. So it could be nearsightedness, farsightedness, or astigmatism, or even presbyopia, which is the need to wear reading glasses. And as Dr. Mukhtar mentioned, glasses are very safe, but contact lenses can be quite problematic if they're not taken care of properly. And we see, sadly, a fair amount of number of infections from contact lenses. So if you're going to wear contacts, you must be very, very careful. Never use tap water when you're wearing them. All right, so here we are. Here's our service. So you've met me and Sabrina, Dr. Mukhtar, and we also have Dr. Prakash, Dr. Maman, and Dr. Janji, who join us in our refractive surgery team. And more than that, here's how we think of ourselves.
We are the Avengers.
Yeah, we kind of think, I don't know who the Hulk is, but it depends on what kind of day you're having. But truly,
yeah. We're really passionate about offering these services to our patients if they're a good candidate. And that's the biggest thing is, picking the right patient. Refractive surgery can be life-changing. We have had patients right after the procedure crying because all of a sudden they can see across the room without needing to pick up their glasses or put contact lenses in. People feel like they have their life back, right? They don't have to worry about going swimming or whatnot. So we do feel like superheroes sometimes because that's why we do what we do. We really want to improve the quality of life for our patients, and this is an avenue in which we do so.
Absolutely.
Yeah.
And the thing is, we're also very conservative by nature. So we really believe in offering options to you to become less dependent on your glasses and contact lenses if you're motivated, right? I mean, there's some people who are not good candidates for refractive surgery, and I'm sitting next to one of them right here, right? So, even though we provide this service, not everybody is a good candidate. And again, you only know if you're a good candidate if you come for an evaluation to see. There's so many different things that we do. And in terms of procedures, we have a lot of procedures. It's not just one size fits all. I think one big philosophy of our center is that we want to meet you, assess your eyes, speak with you, and then really figure out what would be the best procedure to meet your goals. And it may be no procedure at all, right? So we are very, very picky. We probably turn away maybe around 40 to 50% of people who come in to see us because they're not good candidates. And so again, we only perform surgery or offer surgical procedures if you are an excellent candidate for that specific procedure.
So to give you an idea of what refractive surgery is, we're very passionate and we, sometimes we'll go into the nitty-gritty of everything, but refractive surgery essentially is a surgical intervention to treat your eyeglass prescription or contact lens prescription, whether it's nearsightedness or farsightedness or your astigmatism. We do have tools to help treat those errors. It really, what the cornea, which is the front part of the eye, so the clear dome in the front part of the eye, it actually takes in light from your surroundings and bends the light to hit the retina, which is where all of the information gets processed. And so that's what we say, it's the biggest, one of the biggest refractive portions of the eye. And so what we do with refractive surgery is we alter the cornea, which can be with procedures that we're going to go through. But also we can implant a lens inside the eye to help and essentially almost put like a contact lens inside the eye, which is really great. There are so many different types of refractive surgery. And like Dr. Dhaliwal mentioned, it's really, we take a long time with our patients. Our quick evaluations are not that quick, in the sense of when you come in, there's a lot of information that we get from you from an intake standpoint. And again, and we get diagnostic data as well at that first initial evaluation. And the biggest thing is we come and talk to you and we try to find out what your expectations are, what your goals are, because we really want to be able to deliver if we're going to do this possible procedure on you.
Exactly. So it's great because we offer several different types of procedures. So it's, again, not one size fits all. We have 3 different lasers. We have this ability to actually almost like implant a contact lens inside your eye. So let's talk about those things. So first of all, when you come to our center, you're going to have to fill out a form. And this is just a nice kind of overview of who you are, what your hobbies are, your medications, allergies, and your past ocular history and kind of medical history. So we know what types of things have happened to you in the past and what kinds of things you're struggling with, if anything at all. So we also really want to understand your contact lens wear and how you use it, how you use them, and if you're using them carefully. And then this is a really important part. In your own words, we want you to describe your expectations for surgery. And this has been invaluable in understanding what you're looking for. And we've had so many different responses to this question. And again, we want to get on the same page. So that's super important. And so really good candidates for refractive surgery are people who are motivated to reduce their dependence on glasses or contact lenses. So that's basically anybody who's healthy people with healthy eyes. And you have to have realistic expectations also, because we don't have a magic wand. We actually are performing procedures and surgical procedures. So we have to think about the eye. We will perform a procedure, but then you have to heal. So we can control the surgery, but we can't control your healing. So there always could be a little variability there. Ideally, you want to have a stable prescription. So if you're really changing a lot, maybe that's not a good time to do surgery, but we want you to be old enough that your prescription has basically stabilized. So that's typically anywhere from 18 to 21 years. And again, you have to have good ocular health. So if you have severe corneal scarring, or you have a history of macular degeneration or glaucoma, severe glaucoma, you're not a good candidate for refractive surgery. And basically what we kind of like to tell our patients is that if the best vision that you can get in glasses is kind of like the best vision that you could expect after some type of refractive surgery. So if you can't see currently with your glasses, then surgery is not going to help you to see better than that. That's basically kind of a good rule of thumb to think about. How about contraindications?
Yes. So, as a referral center here at the Vision Institute, we do see patients with complex eyes and complex medical histories. So we do go through your medical history. So if you have uncontrolled autoimmune or inflammatory conditions or conditions where you need to take systemic immunosuppression suppressants for, right? To kind of help control your, what we say, inflammation in the body, we usually will defer you. If you have uncontrolled diabetes, just that's not a great candidate. Just like Dr. Dhaliwal said, your healing is not something that we can control, and our diabetes patients will have some challenges there. Any issues with wound healing? So we do ask you, do you have keloids when you scar? You know, things like that. Again, for us to help with wound healing. If you have any, if you're actively pregnant or nursing, we won't do refractive surgery because your prescription and your corneas change during that time with the hormone changes. Patients with other ocular conditions, like Dr. Dhaliwal mentioned, you know, glaucoma, severe macular degeneration. If you've had a retinal detachment in the past, you know, if you're usually being co-managed with one of our other providers, it usually means that you may not be the best candidate. But then also from an ocular surface standpoint, if you have severe dry eye or, you know, corneal dystrophies or cataract, we won't potentially do surgery for you because we also don't want to chase a moving target, and we don't want to exacerbate or make anything worse in the eye as well. Do no harm. If you've had history of shingles in the eye or any herpes infections in the eye, we typically will defer you. And mainly also patients with unrealistic expectations. So we do manage those expectations. The one thing with the dry eye that I would like to mention is that we are very aggressive in treating your ocular surface prior to doing any refractive surgery. And this is to Dr. Dhaliwal's point that we need to have very motivated patients. So there are times that we've had patients wait months before we operated on them. But honestly, they did so well because we made them wait months. And what I like to tell my patients is refractive surgery, it's like planting a seed. So you want to make sure the soil is moist and nourishing so that your flower can grow, right? And so, or plant, or, you know, whatever I'm feeling that day. But the point is that, like Dr. Dhaliwal mentioned, we're very conservative, and we do a very thorough history. And if we're at all concerned, we are more likely to turn you away than say we'll do the surgery. But the one benefit is, and what I wanted to say with the who we are, is you get 6 refractive surgeons for the price of 1. Because we all talk to each other, and if we have any concerns or any questions, we're all there helping each other out. So that's something I really wanted to say as well.
Yeah, thank you. And the other thing is we're all corneal specialists. So if you're not a good candidate because you have severe dry eye, then we would refer you to our Dry Eye Center of Excellence for treatment. So the nice thing is that we can help you wherever you are in your ocular journey based on the findings that we see, and help you in terms of, you know, getting your dry eye controlled, et cetera. And one thing that we say is that nobody died from not having refractive surgery. So this is really only for the very good candidates. So if we say you're a good candidate, that means you've like passed all these kind of hurdles, and we really feel after all of our testing and our conversation that indeed you are a good candidate. And one thing that we also love to say is that happiness after one of these procedures equals the post-operative kind of reality minus the expectations before surgery. So this is why we spend a lot of time with expectations, because after age 40 or so, everybody needs reading glasses. So if you think that you're going to have surgery and you'll be able to see distance and near with, you know, out of each eye at age 50, that's kind of impossible, right? So the eye has limits. And so that's why we spend a lot of time discussing expectations and what, you know, is reasonable. So sometimes, you know, we talk about your recipe for success. So we'll look at you and we'll say, okay, we think your recipe for success is, you know, this procedure plus maybe a thin pair of night driving glasses or something like that. And remember, using occasional glasses is not a failure of having refractive surgery. it's sometimes something that we expect, and that's okay, because for 80% of your life, you might be glasses free and contact lens free, but maybe for that 20%, you may need some type of correction. And that is something that we discuss with you ahead of time to make sure you're okay with. All right, let's talk about these procedures finally, right? So tell us about LASIK. This is a very, very commonly talked about procedure. Dr. Mukhtar.
Yeah, so LASIK, like Dr. Dhaliwal said, is a very common procedure. I think that's what most of our patients, when they call, that's what they want to come in to become evaluated for. And so what we do, and we can play the video at the same time, is we use two lasers. Both are very exceptional. And so the first laser, what we do is we make this thin cap on that cornea, so that clear dome, right? So very, very thin, but safe. And we use that laser then, and as you can see, kind of it goes in the middle first and then around the side. And then we use an instrument to kind of flip that flap back, okay? And then we use a second laser to treat your actual prescription. And our measurements are so precise that this is actually customized treatment to you. So we were part of the FDA studies for this machine called the iDesign. And the iDesign takes in your data, so it takes in the measurements of your prescription to the 100th degree, and it also treats other what we call aberrations, which are just kind of the way the light is bent, and that is the customized treatment. So after that laser, we put that flap back down, and we time for 3. So we wait for 3 minutes, and we really make sure that we are happy. So we are very particular. We never switch to the other eye or close the case until we were happy with how that flap looks right after surgery, right at the end of surgery. And the beauty is you're 95% healed by, I would argue, post-op day 1. And so it's a quick procedure. Patients do very, very well. After the procedure, we ask you to go take a nap. We ask you to take a nap after every procedure, but we'll go through that. So that's LASIK.
That's LASIK. And you can see on YouTube, there's lots of information about all of these procedures. We decided to stick with the schematics instead of showing actual surgeries, because we didn't know how you all felt about watching actual eye surgery. And the thing is, there's pluses and minuses to all these procedures, and truly, every surgeon has their personal experience with these procedures and will guide you according to that as well. Okay, so that's LASIK. And again, the important thing is that we here at the UPMC Vision Institute, we do all laser LASIK. And that's a very important distinction. And we do pretty much all custom LASIK. So that means that, as Dr. Mukhtar mentioned, we're actually measuring your eye, not just for the nearsightedness and astigmatism or farsightedness, but also these aberrations or other reasons why your vision is blurred. They're called higher order aberrations. And we can measure those with a special instrument that we have. And we want to treat not just what's corrected in your glasses, so whether it be nearsightedness and astigmatism, but we want to also correct some of those higher order aberrations. So some people, it's very exciting, and it doesn't happen to everybody, but some people after LASIK, they feel like they see better than they used to see in their glasses. It's really amazing because we are correcting more things. So we can never guarantee that. Of course, it depends on your healing, but truly, when we do our custom approach, now a custom approach basically is like assessing your vision, like you have a fingerprint. Like everyone is very personalized and different, so that no two treatments are going to be the same. So when we image your eye, we get all that information, and then we use that information and use our laser to sculpt a very customized pattern onto your eye. So it's custom all laser LASIK, and that's what we provide. So you can't really compare, LASIK versus LASIK versus, it's very specific, custom all laser LASIK. And that's, we feel kind of, really giving us the best results with that approach. Okay. How about PRK?
So PRK has been around for a very long time. And so what we can do here with PRK is, instead of making that flap that we do with the LASIK, with the laser, we remove a thin, just the superficial layer, the top layer of your cornea very elegantly. And then we will then use the laser to, again, treat your prescription. And it, like our LASIK, our PRK is also customized to you, so that that device is still linked to our laser that does the treatment. And then after we do the treatment, we place a contact or a bandage contact lens over the eye. And so this is a really good option for our patients who are still good refractive candidates, but maybe their corneas are a little too thin for us to do LASIK. Patients who have dry eye, and LASIK tends to make dry eye a little bit more prominent. But the other thing is that, for patients who are very active, or, you'd have to be doing jujitsu, we do LASIK on a lot of our athletes as well. But it's just a really good option to have, especially if you're worried about having that flap made. So a great option that we offer for our patients as well. The one thing we say is that it's one step, it just takes a little bit longer for healing. So that healing process is really important. I don't necessarily think it's one step back for two steps forwards, but it's, you are, the first couple days are just a little bit more irritating because the surface of the eye, you're naturally healing that. But our patients do very well. They're very happy.
Yeah, so PRK was the original kind of refractive surgical procedure. And again, we use the same sculpting laser, but instead of creating a corneal flap, we just remove the surface cells. And so at the end, you do have almost like a corneal abrasion on the eye. So you have to heal those cells. So that takes a few days. And during that time, the vision will be a bit blurry. So you can't expect to see right away. It's blurry for a little bit, and you have to use drops for a little bit longer time. So it's definitely PRK for people who are diligent about using their drops. And after PRK, you also want to avoid a lot of sunlight exposure because that can affect the healing as well. All right, so that's LASIK and PRK. And we have another procedure called the implantable Collamer lens, or the ICL.
So the implantable Collamer lens, it is a great tool to have for our patients. For now, in the United States, we use it to correct for nearsightedness. Previously, and astigmatism. Yep. And so what we do is we do this in the operating room, and we make small incisions into the cornea, which again is that front dome, and it's really beautiful. We go ahead and slip this lens in behind the colored part of the eye, but in front of your natural lens. It is change the game in refractive surgery in the sense of being able to offer something that does not alter the cornea, and it can be completely reversible. So when this first came out, and we've been doing this for quite a while now, before in the first generation, we'd have to make a small little hole in the colored part of the eye to help the fluid or the aqueous in the eye still kind of bathe all of the important structures. But now we have the EVO ICL, and so the EVO ICL has a center port and ports kind of around as well to allow fluid to kind of move through the eye as it naturally would. Previously, we would reserve this for our very nearsighted patients with astigmatism or not, who were not good LASIK candidates. But this is a great option for our patients who may even still be LASIK candidates, but maybe want something that's reversible or have, other job requirements or so on and so forth. And again, we go through and really try and understand what your life is like and what your expectations are and what your needs are. And honestly, the main thing that we look at is what your prescription is and how much space you have in the eye. So we're very diligent about sizing. So these implantable Collamer lenses, we pick your lens based on your prescription, but they come in 4 sizes, and we kind of equate them to being small, medium, large, and extra large. And so we spend a lot of time and we take a lot of tests. We do a lot of testing to make sure that we are picking the right size for you. What is really great about the EVO lens is because of that center port, we can sleep a little easier because the sizing is a little bit more reliable now because of that EVO. And another thing to really just say is that as the UPMC Vision Institute, we're at the forefront. So we're always looking at what's new, what is best for our patients. We're quick adapters to adapt technology that will be better for our patients. And Dr. Dhaliwal, of course, is always working with all of our refractive surgery partners across the country and the globe, really giving insight into what our patients need. So she's definitely a champion, and she's a main reason for why we have the ICL here at UPMC Vision Institute.
Well, you know what? I have to say, this is a procedure that's been so exciting. When this first came out, I just thought, why would we implant a contact lens inside the eye when someone can wear it on top? And then I started thinking about it, and this has been in use all over the world for many, many years. It's been FDA approved since 2006 or 2007, so for a long time. And we got started, and first, I just wasn't sure. And I called one of my colleagues in Europe who had been using it for a decade or more. And I said, is this a good thing to do? He said, Deep, it's a no-brainer. Patients are so happy. So we started, and we are so, again, I have to say, this is a procedure where the more you do, the more you want to do, because the results are really quite exciting. The downtime is very little. This lens, it's very thin. It's not at all like a cataract implant lens. It's completely different. This is very thin, very flexible, and you can see the shape of it. It sits behind the colored part of the eye, so it doesn't have to scar in. It doesn't really change anything. We just kind of slide it in, and it is biocompatible, meaning the eye accepts it very, very nicely. So it's really remarkable, I have to say, when you see the lens in the eye after 5 years, 7 years, etc. It just stays there. It just doesn't cause any really much reaction. And even right after the procedure is done, there's just not a lot of inflammation. So for those of you who might say, well, I'm excited to try something, but what if I don't like it, right? So this is the only procedure where we're not taking anything away. So when we do LASIK or PRK, the sculpting laser is actually vaporizing some of the cornea. So it does permanently change your eye. This is the only procedure where we don't permanently change or take away anything from you. We're just adding this technology inside the eye. So if you, after the procedure is done, for some reason, if you have glare or you have something and you say, you know what, I kind of want to go back to where I was before, we could say, okay, let's do it. And knock on wood, we've never had that request since we've been doing this. And so it's been a really, really lovely option. And this is the procedure that will create the least dry eye. So basically, this does not cause more dry eye. Both LASIK and PRK can cause a little bit more dry eye. So for our patients who may have some dryness, this is, again, a lovely procedure because it will not induce more. So again, very exciting. This is only for people with nearsightedness and astigmatism. We cannot treat farsightedness with this, the EVO ICL in the US, but in Canada and other countries, that is approved in those countries. All right. We have something very exciting to tell you about. Free LASIK at UPMC. Yes, yes, indeed. This only happens when we're conducting an FDA trial. So this FDA trial is for farsighted people. So if your prescription is a plus something, not a minus, a plus something, that means you're farsighted. And if you're farsighted and you're 22 years or older, your prescription is +1 to +4, and you can have astigmatism up to +2, then you should call this number because you might qualify for free LASIK. Now, this is a study that is being done. There's a new laser, it's called the Teneo laser, and it's made by Bausch and Lomb. And it's actually FDA approved for nearsightedness and astigmatism in the US. So it's not an experimental laser, but they're wanting to get it approved for farsightedness as well. And so we were invited to participate in this trial. It's an honor to be invited to participate. So we have the laser here, and you have to be a very good candidate, just like in any procedure. So you want to call the number 412-642-5421. That's the number actually you call if you want to be evaluated for any of these refractive procedures. We have a wonderful person who will answer the phone. Her name's Tammy. Tell her that you say, you saw the webinar, you say hello. So 412-642-5421, and you can call and you can see any of us. There's also an email for the study as well if you want to see if you're a candidate, and that's Deepa's email. Okay, and we're just going to wrap it up. Here's a little video that the Eye and Ear Foundation, and again, we're so thankful to the Eye and Ear Foundation for kind of helping us in this journey. I don't know if you can hear the music a little bit, but the Eye and Ear Foundation made this little video about what we do here. You're going to meet Kristen. She's one of our wonderful staff members. And this is our laser in use. That's me talking about the procedures. We have fun, we laugh. We really love what we do. We're passionate. That's Karen, who's our coordinator. She also helps us with procedures. And we would love for you to come and meet us. All right, I think that's all we have. We're happy to answer any questions you may have.
Well, thank you both. That was a great presentation. Obviously, there's a lot going on in the refractive suite here at the Vision Institute. And we do, as you can imagine, have a lot of questions. So I'm going to dive right in, and you guys can take turns or whoever's best to answer them. So first question is, what are the risks to patients if they get surgery when they aren't good candidates?
Okay, so a lot can happen. We've seen the good, the bad, the ugly from refractive surgery. And really it can be devastating. So you can have, actually your cornea can get too thin, so then it could bulge forward and you can actually lose vision instead of gaining vision. You can also have severe intractable dry eye that it just cannot be handled. And, sometimes you have to get back into a contact lens, a special contact lens to help that. So basically the short answer is you will lose vision instead of gaining vision.
Can you correct for prism?
No. Great question. Prism can only be corrected in glasses. So if you have double vision, you are not a good candidate.
How important is it to go to a doctor that has the most advanced lasers?
I think it's important to go to a doctor who has intimate knowledge about the lasers, right? So I think it's important to have somebody who has a breadth of experience and has a breadth of experience with all the lasers, because every laser works a little different. There's almost, an art to performing every laser. So it is important, I think, but it has to be somebody who has good knowledge, because just because something is new doesn't always make it better either.
Yeah, I think it's critically important. I think that, you know, you have two eyes for your whole life. And this is not where you want to shop for a bargain. Okay. And I think that LASIK is not a commodity. Neither, you know, nor is PRK or ICL. Like, these are procedures that are performed that are dependent on the surgeon expertise and follow-up and healing and all these things. It's a whole system. And we are blessed and very fortunate to work with an amazing team at the UPMC Vision Institute. In our refractive surgery center, we have a wonderful team. And it's because of the team that we can provide these procedures. If we didn't have the amazing staff who we work with, we would not be able to really function. So the ICLs, again, are done at our UPMC Vision Institute operating room. And we are, again, very fortunate. The staff there are amazing. So you want to go to the best place. You want to go to a place that has the most advanced, you know, advanced technology and surgeons who have been doing this for a long time, and who have knowledge and are adequately trained to do this.
If a patient has a family history of glaucoma but doesn't have it themselves presently, are they a good candidate?
So it depends, right? So we do a lot of testing, and we would have to do our own independent evaluation, and basically we stratify the risk. But we take in all of the information, but definitely somebody that I would encourage to come in for an evaluation.
Yeah, absolutely. So glaucoma does have a genetic predisposition, but it's not a definite that you're going to develop glaucoma. And there's so many different types of glaucoma. So again, I think that, yes, very possibly that patient could be a candidate.
Are there any conditions that would make refractive surgery more of a medically necessary procedure more than an elective procedure?
Okay, so this is like a passion of mine. So it's very interesting. 25 years ago, we did a study looking at children who had lazy eyes that were not able to be treated with conventional means, like with patching, glasses, contact lenses. And basically, if you have a lazy eye as a child and that's not corrected by a certain time point, then you're kind of stuck with a lazy eye that doesn't see well for the rest of your life. So we looked at this kind of group of patients, and we thought, gosh, wouldn't it be great if there was something we could do to help these children? So we did LASIK in children. And this was, again, 25 years ago. And we were one of the first groups in the world to do this. And it was really, really quite an amazing procedure for these children. Now, it didn't help them reverse all of the lazy eye necessarily, but it did help them work with their both eyes together. And there were definite subjective benefits to these children. We actually published a paper where we saw them 16 years after they had the procedure, and we assessed how they were doing, and they still remember how impactful that procedure was when they were age 7. So we're not actively doing this right now. We're trying to get things in place to possibly provide this. So we're not ready to see these children with lazy eyes, but that was an example of therapeutic refractive surgery. So in children, and we have presented on, basically therapeutic refractive surgery for children who have lazy eyes, who are not really responding to conventional therapy, or maybe have neurobehavioral issues where they're not able to tolerate glasses on their face, or maybe they have other issues. So we're really kind of holistic in our assessment of candidates for refractive surgery. So we really want to use refractive surgery for helping people, not just, and again, we don't think of refractive surgery as cosmetic surgery. We really think that it's a safety issue for many, many people, where if you take your glasses off and you're legally blind and you're in the ocean and your glasses fall off, I mean, that's scary. And I've heard these stories over and over again. There was another patient who came in. She said she was on a bus in China and her glasses, were knocked off her face. So here she's in a foreign country, highly nearsighted, and her glasses are not like anywhere near her. And the next week she was in our office for a refractive surgical evaluation. So this is not just for people, this is, again, not something that we think, oh yeah, it's just because you don't like the way you look in glasses. No, this is much more than that. This is, again, something that really can enhance people's lives and make you feel much safer and sometimes much more confident in certain things, activities that you're engaged in.
Do you also do refractive cataract surgery?
Absolutely.
Yes, absolutely. So when we do cataract surgery, because Dr. Dhaliwal, when she used to lecture us, clinically as a resident, so even cataract surgery is also refractive surgery, right? And so when you come in, or if somebody comes in for cataract evaluation, we are asking very similar questions. What are the top 2 things that bother you? We start out asking, what do you do on the day-to-day, right? We're trying to figure out not only what type of lens to put in, what refractive target, whether we're going to do it manually or use a laser to help us with cataract surgery. And it really is to be there in line with what our patients are doing on a day-to-day life, right? To help them. There are a myriad of lens options out there, and there's a place for every one of them. And it just depends on our patients' goals. But the bottom line is, yes, we do refractive cataract surgery, and we have the best diagnostic instruments out there to really get that target as best as we possibly can. And we have very sophisticated machines to help us out as well.
Yeah, thank you for that question, because cataract surgery, again, is your opportunity, right? If you are really motivated to reduce your dependence on glasses and contact lenses, and you have a cataract, golden opportunity to, at that time, when the cataract is removed and the new implant is put in, there's so many choices, as Dr. Mukhtar mentioned, as to which implant goes in. So that is super important that you have that discussion with your cataract surgeon. We both perform cataract surgery. The entire cornea division performs cataract surgery. And the important thing is to, and we have many, many other surgeons at the UPMC Vision Institute who do excellent cataract surgery. But my point is that whoever you pick as your surgeon, make sure you have a discussion ahead of time with what your goals are for cataract surgery. So it used to be, 20 years ago, maybe 30 years ago, it was kind of like, we just always targeted distance vision after cataract surgery. Not anymore. I mean, anymore, I feel like, and I think you agree with me, like intermediate vision, which is kind of like a computer screen, that vision is super important. That's kind of like a dashboard, things like that. So there are options, but you have to have that discussion ahead of time so that your surgeon's aware that you're interested in exploring those options.
I guess a somewhat related question is, does having refractive surgery make future age-related issues such as glaucoma, macular degeneration, or cataracts a bigger challenge at that time?
Another great question. So I'll tackle one of those things. So in terms of future cataract surgery, it used to be if you had LASIK, it was very challenging to figure out the lens implant power because the cornea was changed. It was a different shape. Now we have formulas that are built into our diagnostic equipment that we just check a box. Oh, you had LASIK for nearsightedness. You just check the box, and then all the formulas come through, which already take that into account. So honestly, I feel like now it's not the challenge and the struggle that it used to be. You just have to have the right diagnostics and have the right history and make sure you have great staff who actually ask the right questions and populate those fields true to the patient's individual condition. So with that, cataract surgery is not more difficult at all. And in terms of if you're going to develop glaucoma or macular degeneration down the road, your eye is still going to age like it's going to age, whether or not you had LASIK or PRK or an ICL. It's still going to continue to age. And having any of these procedures does not make you more predisposed to developing future problems. So I think, you know, we feel comfortable in addressing any challenge that comes down the road, but like when you have a cataract and you had LASIK, or if you had an ICL and then you develop a cataract, you know, with the implantable Collamer lens, it's actually really easy. The formulas don't even change when you develop a cataract, and we just take the ICL out and do the cataract surgery just like you normally do.
What percentage of people repeat LASIK surgery?
So it's a very small percentage. I mean, it should be a very small percentage because, you know, your eyes should be stable. And we have really great eye trackers now, so that, you know, even if you're moving your eye a little bit, and again, every laser system is a little different, but the eye trackers these days are really amazing. So the predictability of LASIK and PRK are very high. And with ICL, there's, you know, very little healing that you have to do. So that's pretty spot on. But the redoing a LASIK would only happen if there was an issue with getting to the target that you wanted, right? So again, that's even a smaller percentage than it used to be. It's less than 5%. But I will tell you, the disasters that I've seen lately have been in patients who had their LASIK done again, or an enhancement procedure for a small correction, because in an outlying center, they had bought this kind of lifetime guarantee type of thing. And so they thought, oh, if their prescription changed a little bit, they should go back in and just get it retouched up. It ended up being problematic for the patient, and they saw me as a second opinion. The answer is, if your eye's changing because you're developing a cataract, don't have another LASIK procedure. Just wait until the cataract is ready to be removed and then have that addressed. So as you get older, your eye's going to change. You're going to develop a cataract. You know, if you're lucky to live long enough, every single person in this world will develop a cataract. So that's normal. But as you're developing a cataract, your prescription starts changing. So when that starts happening, do not have more LASIK or PRK to try to correct that. Just get a thin pair of glasses. A thin pair of glasses is much better than having more surgery, because again, there are definite complications. You can get an infection, glare and halo. Like, we didn't talk about the risks of any of these things, but they're real. So infection can happen anytime you operate on any part of the eye or body. Glare and halo can be an issue. So we want to do a custom treatment because that reduces glare and halo. Also, if it's a very high prescription, doing an ICL would lead to less glare and halo and better night vision than actually LASIK or PRK. So, there's real risks to doing these things. And again, when you do retreatments, it means you're thinning the cornea more. So we've seen cases where they thin the cornea more, and then that patient develops a corneal instability, meaning that cornea starts bulging and it develops like a keratoconus type of situation where it's thin and bulging, and the patient ends up losing vision instead of gaining vision. And that's really heartbreaking to see.
This is a perfect question for Dr. Mukhtar. Does dry eye make vision worse, and is there a cure for dry eye?
Oh, my
wow.
question.
Funny you should ask.
Funny you should ask. So, dry eye can contribute to fluctuations in vision. So if you wake up and as the day goes on, your vision is getting blurred, or if you're on a screen and then over time you notice your vision is getting blurry, that is usually related to dry eye. Severe dry eye can cause blurred vision, but the good news is we have a lot of treatments. Dry eye is a chronic disease, and so it does require, motivation on the patient's for the patient's perspective as well. But just like in refractive surgery in our dry eye clinic, we also take a very personalized approach. So we also have longer visits, again, trying to figure out all the different reasons why one person may have dry eye. And so one person's recipe for success will look very different than somebody else's. And so I don't like using the word curing of dry eye because that makes it sound like I'm going to do one thing and you'll never need anything again. But we have high success rates of dealing with dry eye and finding that recipe for success so you can maintain your quality of life and quality of vision.
This question's kind of specific, but I think it's interesting, so I'm going to go ahead and ask it. It's if a person is nearsighted and farsighted and has an astigmatism, can they have the ICL lens behind the cornea, but then wear reading glasses for their farsightedness?
We have such an amazingly smart audience. Yes, brilliant. Absolutely, 100%. That's exactly what we do. Exactly. We implant the ICL to treat the nearsightedness and astigmatism, and then reading glasses over top. Sometimes we do a little bit of blended vision, which is something we do after cataract surgery too, but with an ICL, it works great, even with LASIK, where the dominant eye is targeted for distance vision and the non-dominant eye can just be kept a little tiny bit nearsighted so that you have this kind of blended vision that helps with reading or intermediate vision. But that's exactly right. So you have ICLs in both eyes with a thin pair of reading glasses, and it works great.
And the one thing I wanted to say is that we do trial the blended vision for you in glasses, or if you are a contact lens wearer, we'll ask you to trial it just so that we know that you can handle the small change and difference in prescription before we go ahead and do surgery.
Can you have this done if you've had a horseshoe tear in your retina that was successfully treated by laser?
Absolutely. Absolutely. But we would want to so the good thing is none of these procedures increase your risk of retinal detachment. Being highly nearsighted, just being highly nearsighted and not having any surgical procedure will increase your risk of having a cataract early, developing a retinal detachment or a retinal tear, and glaucoma. So nearsightedness causes your eye to be more predisposed to those conditions in life. Okay, so luckily, the procedures that we discussed, LASIK, PRK, ICL, none of those procedures increase the risk of retinal detachment. So if you've had a retinal hole or tear that was successfully treated, we would recommend another retinal evaluation before surgery is done, but that does not make you automatically disqualified for having the procedure.
Is there an upper age limit?
I'm going to let you answer.
Okay, so basically, you have to be a healthy person with healthy eyes.
Yeah.
So if you're 60 and you're a healthy person with healthy eyes, come on in. So that's the age limit. We don't have an age limit because we want, again, a holistic approach. We don't feel like, oh, just because you're 50, now you're 51, no way. We really would welcome you to come in. We will evaluate you. But again, our criteria are very strict. So if you're developing cataract that's significant, we're not going to offer you, a refractive surgical procedure such as LASIK or PRK that's going to change your cornea. Now, having said that, if you have like a tiny touch of cataract, I still, and Dr. Mukhtar would still offer you an implantable columnar lens, or the EVO ICL, because that's not going to change your cornea, and it's lens-based inside the eye and really should not alter the optics. So, again, it's a personalized approach, but there's no upper age limit as long as you're healthy.
We're actually at the limit, but I'm going to ask one final question that was submitted, which is Medicaid and insurance accepted, and or does it pay for these procedures?
We wish.
Yeah,
We wish. Okay, so sadly, even though we don't feel like this is cosmetic surgery, the insurance companies feel that this is totally something that's out of pocket. So they will not cover any refractive surgical procedure at all. There is nothing that is qualifies for insurance coverage, Medicaid, Medicare, commercial insurance. None of those payers will cover any of these procedures, very sadly, but that's the reality that we have. We wish it would be covered, because honestly, if you look at the infection risk from a contact lens that's worn, for many, many years versus the infection risk from having a refractive surgical procedure, it actually is less from having refractive surgery versus wearing contact lenses for a number of years. So, there's evidence, but we're never going to fight that fight. That's never going to be a winning battle. But, the thing is, when you look at the cost that you spend on glasses and contact lenses and contact lens solution, and having that year after year after year after year, you think about all those hundreds of dollars, they all of a sudden add up pretty quickly. And then the cost of having a one-time surgical procedure, or refractive surgical procedure, actually makes economic sense for a lot of people. But, and then a lot of our patients use their FSAs, their flexible spending account. So they get pre-tax dollars, and they get, a benefit from that as well. And if you're a UPMC employee, you get a discount if you come to our Vision Institute. Also for first responders, we're very, very grateful for all of your work that you do, and so we really offer discounts for all those people.
Well, again, thank you both so much for the great presentation and for taking time to answer all of our questions. And thank you to the audience for joining us today. We'll look forward to hosting another webinar in 2 weeks. And with that, we'll say goodbye, and I hope everybody has a great weekend.